Welcome to OET Answers.
Occupational English Test, Listening Test Part A. In this part of the test, you'll hear two different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. At the end of the test, you'll have 2 minutes to check your answers. Now look at the notes for Extract 1.
Hello, doctor. Good evening.
Good evening. Could you describe your problem?
Well, I'm having disturbing asthma and facing difficulty in walking even 5 steps. My weight is 360 pounds. I have high cholesterol and high blood pressure. I have joint pain, back pain, foot and ankle pain and swelling on my right leg and foot. I have sleep apnea and snoring. Moreover, I am a diabetic patient on medication. I also have hemorrhoids, doctor. I am also pursuing surgical attempts for weight loss and to become active in my life again.
What's your age?
33, doctor.
Okay. Do you drink or smoke?
I do smoke socially, and I stopped drinking alcohol a year back.
Have you undergone any surgery earlier?
I have undergone orthopedic knee surgery recently, doctor.
Can you brief me about your family history of diseases?
All my family members have obesity, heart disease and diabetes and are negative for hypertension and stroke, but I am using Champix to stop smoking completely.
Okay. Tell me about your food habits.
I eat things like bacon, milk cheese cheeseburgers and fast food.
How many times do you eat in a day?
I eat 4 times a day, 8 in the morning, 12 at noon, 8 p.m. and 1 a.m.
Well, the ideal weight for your age is 184 pounds and you are weighing 360 pounds. That means 184 pounds in excess. What medications are you taking?
Metformin, Crestor and Ramipril.
Do you have any chest pain or any mild attacks?
No, doctor.
Well, your cranial nerves 3 to 7 are intact. Neck is soft and supple. You have positive wheezing bilaterally. Heart rhythm is normal. Abdomen is soft. You have 1+ pitting edema. I have reviewed your complete test reports. This is a clear case of bariatrics, and you need to go for a laparoscopic ruin by gastric bypass. The complications include infection, bleeding, pulmonary embolism, deep venous thrombosis, leakage from the gastrojournal, anastomosis, and possible bowel obstruction. Before we proceed for the surgery, you need to get reports on upper endoscopy, H. pylori testing, thyroid function tests, Lefty's glycosylated hemoglobin, and fasting blood sugar.
Okay, doctor, I am ready for the surgery.
Extract 2, questions 13 to 24. Now you hear a healthcare professional talking to a patient. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. Good afternoon.
Yes, good afternoon. May I know your problem?
Well, doctor, I have a sinus problem. I get postnasal drainage, facial pain, headaches, sore throat and congestion.
Since how long have you been facing this problem?
For the past 3 weeks, doctor. I'm also getting snoring, teeth, pain and nasal burning.
Is it moderate or severe?
It worsens in the evening and afternoon.
What's your age?
51, doctor.
Did you have any illness previously or any surgeries?
Yes, surgeries like gallbladder and hernia.
Do you drink or smoke?
I don't drink, but I have smoked 3 packs of cigarettes per day for the past 19 years.
Do any of your family members have any illness?
Yes, I have a family history of acute allergy and diabetes.
What are the medications you are taking?
Claritin, Dilantin, and Rhinocort nasal spray.
Are you allergic to any medicine?
I think no, doctor.
Well, your articles. External auditory canals reveal no significant abnormalities bilaterally. Terms intact with no middle ear effusion and an insufflation. Your intranasal exam reveals moderate congestion and purulent mucus. Your oral phonics examination shows teeth leave your lower reaches. Reveal missing molar examination of the pristine area pharynx shows a prominent uvea and prominent postnasal drainage. The palatine tonsils are 1+ and cryptic. The palpation of the anterior neck reveals tenderness. Examination of the posterior neck shows mild tenderness to palpation and of the suboccipital muscles. Facial examination shows there is bilateral maxillary sinus tenderness to palpation. Waters view X-ray reveals bilateral maxillary mucosal thickening. You have acute maxillary sinusitis for 63.0, snoring 755.09. Well, I am prescribing you Augmentin for 869 mg twice a day, and mucus-fed 809 mg twice a day. Follow these medications for 4 weeks and meet me after that. If the conditions don't improve, then I will order a mini sinus CT.
You now have 2 minutes to check your answers.